say that. And, you know, so much of what the president said is he said he wanted to bend the cost curve down. This report says that if we do these things that are in the Reid bill, the cost of care will actually go up faster than if we did nothing at all. And for people who buy their own insurance, the cost of their premiums will go up faster than if this Senate passed nothing at all.
So just if I'm understanding, so we're going to cut $1 trillion when fully implemented out of Medicare. We're going to add $1 trillion in taxes when fully implemented from Medicare. We're going to run up the debt, we believe, on this side. We're going to increase premiums, and costs are still going up.
For people all across the country, costs are still going to go up. Businesses, their cost of doing business will go up. For families who buy their own insurance, their costs of their premiums will go up. For people who are on Medicare, they are going to see tremendous cuts into that program, and they depend on that health care. So costs are going up for people who pay for their own care, for businesses who try to build jobs. And we know that small businesses, according to the National Federation of Independent Business, the small businesses of this country, the ones that are the engine that drive the economy, 70% of all new jobs come from small businesses. They are going to be penalized to the point they're not going to be able to add those new jobs. And they say we will lose across the country 1.6 million jobs over the next 4 years as the government keeps collecting the taxes but doesn't even give any of this health care services because those have all been delayed for 4 years.
We have about 6 minutes remaining in our time. I wonder if the senator from Georgia, having heard the comments, has additional reflections on.
Yeah, I'd like to ask a question to the senator from Wyoming, who is a medical doctor, who prior to coming to the United States Senate was an active orthopedic surgeon. I've had physicians come into my office by the droves and talk to me about Medicare before we ever got into this health care debate. And what I heard was in reference to the reimbursement rate under Medicare to physicians and to hospitals being so low. In fact, the American Hospital Association has come out just in the last 24 hours and pointed out that hospitals across the nation get a return of about 91 cents for every dollar of care provided. Now, that's not 91 cents of the amount of charges from the hospital to Medicare. It's 91 cents of the cost of the care provided. So the return is about 10% less to a hospital than the cost that the hospital has in it. And my understanding is that at least 10% less than the cost provided for a physician is reimbursed to the physician under Medicare. And as a result of that, the younger physicians particularly who are coming out of med school with these huge debts that they've incurred as a result of the long years they've required to be in school simply can't afford to take Medicare patients, and they're not taking Medicare patients. Is that, in fact, what's happening in the real world? And will that not get worse under this proposal?
It is happening. It will get worse under the proposal that's ahead of us. And that 90% figure is actually a high number, and I know a number of physicians in hospitals, especially in rural communities, who get reimbursed less than that. The ambulance services don't even get reimbursed enough, and these are volunteer ambulance services, to fill the ambulance with the gas for taking somebody the long distances on Medicare from where they may have fallen and hurt themselves or broken a hip to get them all the way to the hospital. So this is across the board bad for America. We say we want patients to be able to get care. You throw a whole bunch more people onto this boat that's already sinking, which is what the Democrat leader is now trying to do. It's going to make it even that much harder for our hospitals to stay open, especially these communities where there is only one hospital providing care. Much more difficult. But for any young physician coming out with a lot of debt to try to hire the nurse and pay the rent and the electricity and the liability insurance and all of that, these don't even cover the expenses. So that means they have to charge more to the person who does have insurance, the cost shifting that occurs. And as a result, for people that have insurance, they're going to see their rates going up. For people that rely on Medicare, it's going to be harder to find a doctor. For those that are put onto Medicaid, with aid for those who need additional help, which the Senate Majority Leader is trying to put more people into that area, it's going to be harder for them to get finding care. So across the board, there is nothing good with this proposal. And what we have seen today documented from the folks who are objective and look at the whole picture, they think it's actually as bad. They admit it's as bad as we've been saying it is. They say, yeah, you guys have been right. What you have been saying about the cost of care, the impact on health care, and their phraseology is such that I think they absolutely pinpoint all of the reasons that the American people now, by a number of 61%, oppose this bill that we're taking a look at. And it's why the Mayo Clinic has said, in the letter from their executive director of their health policy center, said expanding this system to persons 55 to 64 years old will ultimately hurt patients by accelerating the financial ruin of hospitals and doctors across the country. That's what we're looking at.
How much is left now? Madam President, if I can conclude our time with the permission of the senator from Georgia and Wyoming, instead of racing down this train track with yellow flags and red flags flying everywhere, what people often ask us, well, what would you do? What we would do is what we think most Americans would do when faced with a big problem, not try to solve it all at once, but to say, what's our goal? Our goal is reducing cost. What are the first 4 or 5 steps we could take to reduce costs? Can we agree on those? We think we can, and let's start taking them. For example, small business health plans to allow small businesses to offer insurance to their employees at a lower rate. That legislation is prepared and before the Senate. Reducing junk lawsuits against doctors, that reduced costs. Allow competition across state lines for insurance policies, that reduced costs. Going step by step to re-earn the trust of the American people to reduce health care costs is the way to go, instead of making what this new report from the Center for Medicare and Medicaid Services helps to show, again, would be an historic mistake. I thank the President. I yield the floor.
Would the gentleman yield for an observation?
Certainly.
I thank the distinguished senator for yielding. Thank you for...
The senator's time is expired.